Well, a report came out by the WHO in 2022, at the end of 2022, assessing global oral health. And this was sobering. I think we will all agree that, for example, malignant cancers are affecting 86 million people globally. Respiratory diseases, 450 million people globally. Diabetes 1 and 2, almost 500 million. Cardiovascular disease, just over 500 million. Still the biggest killer. Second only to cancer, and third, incidentally, only to prescription medication taken as directed. Mental health is a big problem, which we are constantly being reminded of, and it's a growing problem, and there are 1 billion people with diagnosed mental health conditions. But here's the sobering thing. There are 3.5 billion people globally that have oral diseases. And I would say that that's an underestimation, considering 50% of the population don't regularly visit the dentist, and most people and practitioners assess oral health. If you're in pain, then there's a problem, and if you're not in pain, then you're not having a problem. And as you will learn in this program, nothing could be further from the truth. So 3.5 billion people is an underestimation, and oral diseases are always accompanied by some form of chronic inflammation, which is the common denominator in all these other diseases, including mental health and oral infections. And that, because of the connection of the bloodstream, is important. And most oral diseases have no pain associated with them. So dental stress, well, I have a weekly podcast, and I recently interviewed this cardiologist, Dr Thomas Levy, who'd written this book called The Hidden Epidemic: Silent Oral Infections Cause Most Heart Attacks and Breast Cancers. This was published in 2017. You can go back and listen to the podcast. It's very interesting, it's very enlightening, and coming from a cardiologist, particularly relevant. And we will be covering that problem in the infection problem in modules 2 and 3. Now, another book came out in 2018, written, no relation of mine, but Professor Paul Ehrlich is one of the world's most renowned evolutionary biologists from Stanford University, who in 1970 wrote The Population Bomb, but he, in 2018, co-wrote this book with a dentist called, it was called Jaws, The Story of a Hidden Epidemic. And we'll be talking about that epidemic, about narrow jaws and crowded teeth, in modules 4 and 5. There is a silent epidemic in Western civilization. It's going on right underneath your noses. Our jaws are getting smaller, our teeth are more crooked and crowded, creating not aesthetic problems, but also difficulties with our breathing. And to that, we could add Thomas Levy's book about oral infections and the fact that at least 3.5 billion people have oral diseases, and you're starting to get a certain idea about why you are sitting here doing this program.